A lot of you are anxiously awaiting getting the COVID vaccine, but it could take months before we all have access. Our Nixon Norman tells us what UAB Hospital's chief says we should do until that time comes.
We're all very excited about the vaccine. We're all very thankful that we have a vaccine available and that we're going to be able to get access to it so quickly. However, I don't think that it's going to have a considerable impact on what we're seeing currently. We have a limited number of doses, and as per the CDC guidelines, those doses are initially being given to healthcare providers, right? Because you need those people to be healthy and able to function if someone gets sick. And I think it will still be several months probably before we have enough doses to have it widespread all throughout the community where the spread is happening. So while we're excited, we're glad to have it, we also recognize that that's not the magic bullet. It's not going to solve all of our capacity issues and our spread issues right now.
So what can people do while waiting for the vaccine?
The problem is when COVID spreads the most is before you know you're sick. And so for me personally, because I take care of COVID patients, I literally every day function as though I have it. And I just don't know it yet. And I think if everyone starts to operate in that way, that's how we'll slow the spread.
The main concern about the vaccine is the time that it took to make, that it's been too rushed.
Everything that we're doing at this point is experimental. You know, when you come into the hospital, you know, we're throwing everything that we can at patients to try to make them better with only months worth of data to help guide us. The vaccines are probably better off than some of our treatments because the technology and the science behind the development of the vaccine has actually come from work that they've done for years.
And for those that doubt the vaccine, consider turning your doubts into research.
I would encourage people, you know, to really get the facts, to, you know, acknowledge the fact that they have doubts, acknowledge the reasons why they have doubts, and feel validated and that it's okay for them to have those doubts, but don't allow the doubt to keep you from getting the facts. Read about it, you know, talk to your doctor about it, and go forward and make a decision from there. But don't stop at the doubt and never learn more about how the vaccine could potentially help you and your family.
Putting the Valley first, Nixon Norman, WZDX News.